Let's move on to this now. The COVID-19 vaccine rollout will be managed using the Electronic Vaccination Data System. The Health Minister, Zweli Mkhize, launched the system earlier today. ENCA's Manqoba Mchunu has the details. Oh, and Manqoba joins us live from the newsroom. Manqoba, thank you. So the Electronic Vaccine Data System, the call to action has gone out, particularly for healthcare workers. What do we know about the process of getting yourself in line to get a jab?
Well, certainly, Tulas, the Health Minister is saying that those healthcare workers will need to apply online in order to secure their spots for the vaccination program that, of course, is expected to begin mid-February. And, of course, they are in line, first in line to receive the vaccination program as part of the phase 1 of the vaccination program itself. And in terms of the process to register, Tulas, it is a 4-step process. And, in fact, it requires those who go online to actually provide their personal details as well as their occupation, and also on that application will be required to give your work address as well as your medical aid details. And the last page of that application process will then take you to the terms and conditions in which you need to agree to before completing that application. And after you have completed that application to us, you'll then receive a confirmation SMS from the department confirming that you have been registered to receive the vaccine. But of course, the minister is saying that those who register may not be eligible. That will be decided by the department based on the priority groups that are being prioritized for this particular vaccine. But the minister also stressing the fact that this particular registration is not mandatory. So those who cannot go online, those who do not have the means to access the internet, may still go to their various vaccination centers in order to receive that vaccine. Take a listen to what he had to say.
Any healthcare worker who cannot register can seek assistance from the occupational health and safety representatives in their municipality. In the event that a healthcare worker has not self-registered, you will not be denied vaccination. You will be registered at the vaccination site. It must just take a few minutes longer. We would, however, encourage all healthcare workers to register before the inoculation call, because this will help us to know how to refine our current allocations and get enough vaccines to the right vaccine centers at the right time.
And Manqoba, what do we know about the process in terms of the phases of vaccination? How will the system assist in terms of management of those phases?
Well, Tulas, the government saying that they're hoping that this system will actually help to streamline the process in order to ensure that the right amount of vaccines or the doses of vaccines are able to reach particular vaccination centers. So they are hoping that they'll get as many people to register online in order to be able to deal with the logistics behind this vaccination process. But in terms of the list of people also that will be involved, we do know that the first phase is specifically earmarked for those frontline workers, but the second phases will then deal with those vulnerable groups as well as those with comorbidities, and then the third phase of it will be the general population, which is about 22 million people that are being targeted for that particular vaccine program. But in terms of phase 1 itself, the department is saying that it will not only be limited to clinical healthcare professionals, so those are your nurses and doctors, but also those who work around these healthcare facilities will be able to be to register for this particular process. And these include the cleaners, the porters, and also those who work around the security personnel. So they're saying that those also may register for this particular process. Take a listen to what they had to say about this particular list of people that are allowed to register.
During phase 1, we are targeting all people working in the health sector. We have to start somewhere, and so we are starting with people working in hospitals and in primary healthcare facilities and community health workers. That's within the public sector, and likewise there is provision for people working in the private sector at hospital level and in primary healthcare facilities or medical centers, GP practices, to be included right at the beginning of phase 1. But we must stress that phase 1 as a whole includes all categories of people working in the health sector. We are including funeral workers, we are including traditional healers. So we have an extremely broad definition of people working in the health sector. And as has been already stated, it includes the health professionals as well as other categories of workers in the hospital and in our health facilities. And all of these people are now eligible to register.
So from those who have tested the system out, Manqoba, I've been hearing only raving reviews in that they're saying that it is swift, it doesn't take long. But I wonder if that will be sustainable going forward when larger volumes of people start registering. What do we know about its efficiency and robustness?
Well, Tulas, the minister is saying that it will actually take you less than 2 minutes to complete this online registration process. And there was a question that was posed with regards to whether or not this system could buckle up. But the minister giving an assurance saying that the system actually will be able to handle the large numbers of applications that will be made. And they're saying that even if it reaches 1 million, it will still not buckle under pressure. So they're quite sure that people will be able to access this application with ease, and that they'll be able to register on time in order to get vaccinated.
All right, thank you for that, ENCA's Manqoba Mchunu. Well, you know what to do, health workers. Go right ahead and go on that system and put your names down, because you are our frontline workers and basically leading the charge, right? And so we'd like you to get vaccinated so that we continue this fight against COVID-19.